Welcome to Santino's World, and today I have a special guest, the one, the only, Sonny Diaz, Sweet Prince Extraordinaire, and Ketamine Clinic operator, facilitator, founder, owner, this or that-er?
All that.
All of that.
All of that.
So we're here, of course, Sonny's is gonna talk about some ketamine. We're gonna talk about some fights today. We've got the greatest fight the history has ever seen this week. We might grab producer Kamuela Kirk in here and see if we can get some of his input as well. But mainly I want to talk about ketamine. And my understanding of ketamine as a kid was people getting high and sitting on their couch.
Ravers.
So it was ravers, like cat tranquility. Yeah. But even before the rave thing, we were like, we had this kid growing up, and I remember he was, we were all crazy. You do what you want, interpret that how you want. I remember this kid, his mother worked at an animal hospital or something, so he would always get ketamine. And he would just be sitting there on the couch, like in a coma. And he was like, yeah, it's like you're just in a tunnel. It's like the greatest thing ever. And then I hadn't heard about ketamine again till you started talking about ketamine opening up ketamine clinics.
Yeah. So my first experience was the raver thing. So I used to DJ at raves, and I would see people on their ecstasy and ketamine just kind of sitting in a corner in their own world. And I was terrified of it back
separately,
then.
or they did it together?
I think
ketamine
they did it together.
Like the candy flip ketamine, though.
Yeah.
That is crazy. So the reason why I want to talk about ketamine is I think it's interesting just in general. The psychedelics are making a comeback at
Huge
first.
Comeback.
Like psychedelics, like shrooms and LSD and all of this stuff. This was like class 1. I think class 1. Yeah, whatever the worst one. Like this is like...
This ketamine's a class 3.
Class 3. But LSD I think was a class 1.
Class 1,
pretty much the worst you can get.
Mm-hmm.
And there was no medical purpose for it at all. And now everyone's doing, there's been a lot of LSD tests. What do they call it?
Shrooms are legal in one of the states. I think it's Washington. Psilocybin is it Colorado?
No, it's Denver and then Oakland.
Yeah.
I think the city of Denver and the city of Oakland did it. Decriminalize them. And we see a lot of people for depression, anxiety, PTSD, a lot of psilocybin and a lot of LSD microdosing and things like that. But tell us about ketamine. Tell us about what ketamine does to the body and what people are using it for. Because I'm interested. We'll get back to this later. I was actually trying to get in touch with USADA over ketamine and actually beta blockers a little bit, because there's nothing on their website about ketamine whatsoever. And if it's not illegal, if it is something that fighters could use, even out of competition, stuff, I think it could do some things.
I think it do wonders. I actually recently looked up the bylaws for the NBA, because a lot of NBA players have actually been coming out saying they have depression. Kevin Love is one of them. He's a big player from Cleveland.
Now, was that pre or post amazing $20 million contract?
Yeah, that's post. Oddly enough, I don't judge by any means, but $20 million does make me happy.
I would not be depressed, but some of us can be depressed.
It's a chemical thing. And
so what do they do in the NBA?
Gotta understand.
So are they?
It's a banned substance.
Okay, it is a banned substance.
It is a banned
substance.
substance.
Is a stance on it?
There is a stance on it. It is a banned substance. My whole goal was actually I wanted to reach out to somebody of that stature and let them at least know that there's help available, not just SSRIs and the medications that they try, and the medications that technically in their bylaws for these super athletes they're not allowed to take in general, and it might affect their game based on some of the stuff that it does.
So how did you get into ketamine? How do you run ketamine clinics? You're owner in ketamine clinics. Before you were in anesthesia, right? And had anesthesia stuff. How did the ketamine come about?
Yeah. So unique thing is that we had created an app for anesthesia, and that's what we were working on. And the app kind of took off. It was doing its own thing. People were using it in hospitals to chart. And then we decided to get back into anesthesia, where we had originally came from my partner, Chris Ray. And when we were doing the mobile anesthesia and some of the other stuff, we decided to kind of dip our hands into some other things. We circled around and we were like, hey, what can we do? He had done a lot of research on ketamine. I had done a lot of research on ketamine. My mom was affected by treatment-resistant depression.
Okay.
And so it was something I kind of knew about. I had talked to some other doctors about, and because he's an anesthesiologist, it was one of those things like, hey, let's give this a run. And our whole goal was, hey, let's try this on the people that we could really help.
Okay, well, how did you guys, who did you start trying? Okay, first of all right, we'll get to who did you try them first. What is ketamine used for treatment-wise right now?
Okay, so ketamine, traditionally what it's used for is pain.
Okay.
So they use it in operating rooms. It causes disassociation, so it makes the patient sleepy and tired and kind of gives them that funny feelings. But it works on your NMDA receptors, the receptors that kind of tell your brain that you're in pain, and it numbs those quickly. And so it's a really great, safe drug for pain. It's non-narcotic. And it actually, in surgery, it's kind of nice because it's a bronchial dilator. So rather than give you something like fentanyl, in certain cases,
it's going to restrict your ability to breathe.
Your breathing. This will open it up a little bit, forces breaths, so on and so forth.
Okay. Now, how did you get? So how did you? All right. So you decide. All right. We're gonna get into ketamine. Ketamine's a thing.
Yeah.
Who were your guinea pigs that you're like, all right, this is a thing. Like, I'm gonna just start grabbing. You just grab random. You grab random ravers off the couch.
I just
from kids.
I went back to my DJ days. I would go behind whoever's behind the turntables and like was asleep. I was like,
you grabbing them. You're
the guy.
You're good.
So technically in medicine, probably not supposed to do this, but we actually started with our mothers.
Okay.
And
but that's where it all starts anyway.
Yeah.
May as well come full circle.
Didn't say that, but edit that out. But no, we actually started with my mom. My mom was treatment-resistant depression since I was a little kid. I've kind of been dealing with her depression. When you're little, you don't really understand depression like that. And so it is a real thing. We knew that ketamine treated depression, anxiety, PTSD, OCD, all kinds of different behavioral health symptoms, as well as pain and chronic pain syndromes. My mom was suffering from treatment-resistant depression, neuropathy, would affect her feet and some other things. And so we decided to give it a shot. We were lucky enough to have some people and know some people that actually gave us some of the protocols for a hospital system that used to treat ketamine that had closed down.
How long ago did that close down? I mean, we're talking about like 1942 or was this?
No, that place was actually in Mesa and they closed down maybe a year before they gave us a protocols. Okay. And so one of the companies that I was kind of doing some work for ended up buying that building. I knew somebody in the building. They happened to give me protocols that were kind of written down, and I took them and we studied them. And at that point, we decided to treat.
Okay.
And so our first experience with ketamine, we did very low dose. We treated based on what the protocol says and what normal protocols for the U.S. are every other day for 2 weeks. So you have to build ketamine into the system.
Okay. First of all, let's get back to your mother. So you started treating her. Did you treat her on that dose every other day for 2 weeks?
Yes. Yeah.
And what are the results that you saw with her in that first initial treatment?
Wow. So first initial treatment was actually kind of scary. Like we gave it to her. She did all right with it. I mean, she was very emotional during the first treatment and
during the actual treatment
itself. And so
how long does that last?
Usually around an hour. So our treatment usually around an hour. There's about 30 minutes of recovery. It is an anesthetic drug, so patients can't tend to go home, drive.
Intravenous, right?
Correct.
Okay.
Correct. And so she did all right. I mean, after the treatment and after she kind of woke up, she has that day buffer. She felt good. She said she felt just a little bit different, like things in her head were a little more clear.
Okay.
And I hear that quite often as clarity. Like a lot of people describe ketamine like driving on the I-17 or driving on the freeway. It's hot. You have no AC and it's packed. Okay. It's 5 o'clock in the afternoon. And then being on ketamine is like driving through a dirt road and nobody's around and windows are down and everything's, just you're free to think.
Okay.
And so we continued to treat her. As we were going about, we were trying new things, knowing that she was kind of our guinea pig.
Yeah.
Adding music, putting on a movie. And we started finding things that worked and what didn't work. Visual things like movies was not a good option.
Okay.
Music was a very good option, depending on exactly what we were playing. I played some music from when she was a childhood. It made her revert back to her childhood and have some kind of disassociation about her emotional response to her childhood. And I was like, abort that. We're just going to put on some music that doesn't have any words. And from there on out, it was kind of smooth sailing and it changed her life. And when I say it changed her life, I mean, it took me months to get my mom into the clinic.
Okay.
And so when we were all done, she called me and it was noisy and it was loud. And I'm like, where are you? Like, what are you doing? I'm not used to hearing my mom out in these streets. And she's like, I'm at Walmart. And I'm like, whoa. And she's like, did you know they sell groceries here? I'm like, come on, Mom. Like,
Mom, when's the last time you gone to Walmart?
You haven't left the house in a while. Like, and so, being able to kind of get your mom back and understand that this medication's really working, it was really unique.
Now, what was she on before that? So you said she suffered from depression. What medication was she taking before that?
So she was on SSRIs. She was on normal,
which would be your Prozac, your Zoloft, things like that.
Depression medications and anxiety medications, the Xanax. And so she used to take, at that point, she was taking one in the morning, one at night before she went to bed. Depression medication, and then she was Xanax all day long.
They almost always go in tandem, anxiety and depression. Exactly. Anxiety for the or Xanax for the anxiety, Zoloft, Prozac, something like that for the depression. It's such a random thing that you always see that.
Right.
So she did that. So she was on those. Is she off of those altogether now?
She has cut down her Xanax to PRN, so she takes it when she absolutely needs it. If she's having an anxiety attack. And she takes one depression medication in the morning, and that's it.
Now, how often is she still doing the ketamine treatment, or like how often does that have to occur?
So she has went on spouts where she would take and do boosters. So like normal regimen of ketamine is you every other day. You kind of build it in the system. Ketamine leaves the system very quickly actually, and then it leaves a byproduct called norketamine in the system. And that's kind of what's causing the neuroplasticity that's occurring with ketamine. So I guess to kind of explain how it works is that ketamine in itself works on your neurotransmitters and kind of gets that glutamate working at that point. It also does this something called neuroplasticity where your neuroreceptors are kind of regenerating almost. And so the best way to kind of, if people are watching hands, receptors closing and then finding new pathways. So glutamate's connecting now.
So it's something to actually bind to. It's 2 weeks. Is everybody on that 2 week treatment initially, or is it a week?
Yeah, there's different protocols based on what we're treating. So if we're doing pain, for instance, we might change the protocol. Certain pain conditions require a lot more ketamine.
Like what type of pain treatment are you doing? Like long-term chronic pain, somebody hurt their back, they've been on opiates, or you broke your hand and it hurts, so you're trying to use it as opposed to opiates? Yeah,
so everything. So very unique. Long-term chronic pain is usually the key right there. So when we're talking about chronic pain, there's so many different conditions, so many different diagnoses, neuropathy, fibromyalgia, like radiculopathy, back pain, like those things are important. We can help with that, and that has its own specific protocol. But then there's other kinds of pain regimens, like for instance, like a migraine or a something called complex regional pain syndrome, which is it is absolutely the worst kind of pain syndrome. These patients, if the AC was to kick on right now, it would hurt whatever they have the complex regional pain syndrome in, whether it be their arm, their leg, or their foot or something. And it almost spreads through the body as well. So it's like the nerves are kind of wound up. And ketamine helps kind of reduce that wind up.
What does it feel like when you're on ketamine? First, have you done
I have
ketamine?
Not done ketamine.
You have not done ketamine. I feel like we need to grab some bags or get some syringes and have a ketamine party over here.
I've had every patient in the world tell me that I should have tried it.
Yes. All right. So what do they tell you? What do they explain the ketamine like? Because contrary to belief, I was not doing the ketamine as a kid on the couch either. So I don't know what is
watching.
Just watching. Watching people just zone out. So how do people explain the feeling of ketamine?
Yeah, so disassociation is kind of the most common word like that I use for it. Patients feel kind of like they're floating. They'll get very numb. Your senses get enhanced. I can tell you, they can hear me on a phone call in my office with the door closed, and they're in a whole nother room with the door closed, and they can tell me everything I just said. It really enhances their senses sometimes. That disassociation can be very strong depending on how much we're giving at the moment. I have a lady that looks at me, and if I have somebody else in the room, she looks at me through one eye, and then when she looks at the other person, she closes and opens the other eye. And I ask her, "What are you doing?" And she says, "Well, I have to minimize the screen so that I can see you, and then I'll bring him back up, minimize you." And she's kind of making it feel like she's actually at work. And she's on a computer screen. I've heard all kinds of different things.
Can you have a conversation with them while they're on
the ketamine? It's a very low dose.
Okay.
Yeah, it's a low dose. We don't, because it's an anesthetic drug. I mean, if you hit somebody with too much ketamine,
you're going to put them out.
You're going to put them out, or you'll put them in a place where the most commonly thing people know is at the hole.
Okay, that's what I've always
is something that you hear.
That's the hole. That's what I've always thought of as ketamine. And so you're not getting them to the point of that K hole.
No.
That's what I always heard of. Growing up, people are like, no, you're just in a hole. You're in a tunnel. Your entire existence is in a tunnel. You can only see a little bit. Okay, that's what I always thought these people were experiencing every treatment. Okay, that's way different. Folks.
So we play a fine line, though. I mean, you want to give enough to where you can affect the patient and get whatever's happening in their life fixed the best we possibly can. And there's times where you overshoot and you put them in the hole.
It's almost like in prison. You're going to the hole.
Yeah, right. and so when a patient's kind of in that K hole, they're stuck. They say they can't move their arms. They don't really make a whole lot of sense.
How long does that take to come out of that?
Now, ketamine wears off pretty quickly. I mean, you can use a benzodiazepam to pull them out of it a little bit, kind of help with the anxiety piece of it.
Which is funny because a benzo will pull you out of a LSD or a psilocybin trip as well.
Exactly.
So that's the thing is people, I would never suggest this as a responsible adult, but if you're going to do LSD or psilocybin, you keep some benzos around. So if you start having a bad trip, you take some benzos, boom, pulls you out of it, normal again.
And so, that and, turning off the infusion.
Okay. And that'll pull it out too.
Pull it right back out.
So you said that people are using this for so anxiety and depression, but what's interesting to me is PTSD.
Oh, that's amazing.
How? So you're getting, and I know that you've been working extensively with the VA and veterans associations to try and get veterans over there with you. Mm-hmm. Especially trying working with the insurance and TRICARE and things like that. Yep. Different options. So you're getting people that are in war. I mean, these are war zone PTSD veterans who, I know my father was a PTSD, or had PTSD from Vietnam, as a Vietnam veteran. And there's major stuff. I mean, thunder went off, boom, he's on the ground thinking that he's getting shot at. We wake him up, by his feet. I mean, there's a real thing. How does the ketamine affect PTSD and help it mitigate that?
First and foremost, though, before we even move to that actual question, a lot of people just don't understand PTSD. It is a very serious situation, and it's not just veterans. It's first responders. It's people who've went through a traumatic experience in their life, and they just cannot let go of that situation, and it chemically changes them. Okay. And I just recently actually went in Bakersfield. I was at a first responder symposium for PTSD in general. I got to hear a lot of good speakers, a lot of people talking about their PTSD from their first responding, the accidents and the children and all kinds of things. And, it really affected me almost emotionally to really get to hear some of these stories.
It's hard. You see some of those, Camuela, producer Camuela over here, his father is a police officer, and some of the stories that he said, with kids. I mean, that's the thing with kids. Adults, you see adults, not to say that we're desensitized to it, but seeing an adult in a bad situation, not murder, but just, car accident, cut up, crying, dead, that's a thing. But a child like that, I can't fathom. I have 2 kids, you have kids. That would be hard. I don't know that I could ever get that out of my brain.
Yeah, and so real thing, when we're talking about ketamine, I wish I had an exact answer or there was an exact science to why it works so well.
But you're getting results, right?
Yeah, absolutely. So we're getting really amazing results. For some reason with the PTSD, the patients do really well. And so I wish I had the ability to say that about every depression patient and every anxiety patient, every OCD patient. But for some reason, PTSD, these patients tend to do really, really well. Really?
Now, what about even childhood PTSD thing? I mean, is it more of would it help things there? Because I feel like childhood PTSD, abuse, things like that, that's a little bit more ingrained in them as a human that will cause psychological, a lot of other psychological issues as opposed to a wartime thing where you had an experience, it was traumatic versus having, childhood abuse. Have you had the same results or is it different or what?
No. I definitely had the same results. I think that we've treated minors before. I think ketamine in itself is an amazing patch. the more you do ketamine, hopefully the longer you can space out those boosters and how often, the frequency of which you come. But there also has to be kind of a continuum of care. You still have to be able to talk with your psychiatrist. You have to be able to kind of let go of these problems. It seems like when people with PTSD do ketamine, they seem to let go of whatever was bothering them.
Okay.
Not to say that won't come back. Everybody has one of those days where they're thinking about that process.
But I've heard the same thing with psilocybin and LSD, is that it lets you just are free of the things that were attached to you beforehand. And that's some of the same things that why I think we're starting to see the psilocybin, the LSD. With that, and you'll see a lot of people, actually, personally know a few people that regularly will do some psilocybin, some shroom kind of, they call them cleansing. You kind of once a quarter, twice a year type of thing, and they'll eat some shrooms, and then they're, like you said, the reset button is pushed. They're back, they're free. What's the word I'm looking? Because it's not necessarily like these people are anxiety or even depression, or experience depression. Almost seems like there's a buildup, a stress.
Right.
There's a level of stress and things are, attaching to them. And then they go on these, even what's the one, the ayahuasca, any of these. And you see them really being emotionally and mentally strong and clear, free, for the lack of a better term. For most people, I know people are going to be different. So I'm assuming most people are going to do a week to a 2 week treatment every other day. How often are you seeing people come back for the boosters? Is it
so? Usually around 3 to 4 weeks is what I typically see.
Okay. And how often is that again for 2 more weeks, or is that just once?
That's just once.
Oh, okay.
Yeah, just
so
once.
you just come in one day.
Just
okay.
one more. And it really depends on what they're treating. In that kind of, in the scheme of things, statistics say somewhere the ketamine says 30 to 90 days. I would say from what we've seen in a clinic, or in the clinic, shall I say, 3 to 4 weeks is what we're seeing patients come back at. And then, as time goes on, I've been able to see them space that out even longer and longer. So if that is changing chemistry in the brain, that's probably something that needs to be really studied. And I think that's kind of where we're at in our clinic, trying to figure out those specific things.
We figure how many people are on anxiety meds, depression meds, all of this stuff. I mean, a buddy of mine, him, Ivan, he's a lawyer. He said he didn't know how often he sees 18, 19, 20-year-old people come into his office trying, legal advice, illegal, this and that. Like, oh, what do you do for a living? This and that. Oh, I don't work. Oh, well, how do you make money? I'm on disability. For what? Anxiety, depression. These are 18, 19, 20-year-old kids.
Absolutely.
Who cannot function in society, and they're in disability. And, how many people do we see? I have no idea on this other stuff, but even microdosing, low dosing LSD and psilocybin, even separately from ketamine, because ketamine seems like it's a little more researched. It's got to be better than taking these SSRIs for 20 years. And
yeah, there's so many drawbacks to taking all those pills.
Yeah.
I think the newest thing, and some of the younger psychiatrists, we'll say, are really looking at ketamine in a very unique way and using it as a first response rather than just throwing a whole bunch of SSRIs at a patient. SSRIs generally take 2 to 6 weeks to work.
Depending you get
on
people
how they
doing,
metabolize and so on and so
stuff,
forth. And then it might not work, and there's a bunch of drawbacks to taking those, rather than now, give the patient ketamine right out the gates, see if we can get their PHQ. That's how we...
What is PHQ? What does that mean?
PHQ is a scale in which we kind of measure how bad the depression really is.
Okay.
See if we can kind of level the patient out, get them feeling good again, and then start them on their SSRIs.
Okay.
And see if we can kind of balance everything out. If the SSRI is working, they're in a good place when they started taking them, and they're in a good place 2 months later, we know that the SSRI worked, and we're already in a good spot. So immediate transformation for the patient. So I'm seeing that more often, which is fantastic. I think that's a really good rate to go. I'm not a psychiatrist, but I think it's very unique.
What do you see the most of? What do you see? What do you treat the most? Depression, anxiety, PTSD, pain?
I see a lot of pain and a lot of depression, but usually anytime that you deal with pain, there's comorbid depression involved as well. So we take those measurements on everybody. And so you'd be surprised how many pain patients come in and they have very high PHQ scores and they lower. Now, for pain, ketamine is not a cure. It is an amazing Band-Aid.
Okay.
But even if we lower that pain rate, and they say the patients was saying they were at an 8 or 9, and now they're at a 4 or 5, what that might be debilitating to us, no more longer is debilitating to them. They don't look at that pain the same way they used to.
And they're probably supplementing with less opiates.
Yeah, exactly.
Yeah, exactly. And that's the thing. I mean, and that's actually the thing that I think why I am so interested in ketamine is the opiate issue. Because you're not only a ketamine extraordinaire, but you've been in MMA for a long time. You've trained MMA, you've been around the sport. How many people have we seen in this sport or heard of over the years that have died from
we've lost some good ones.
All of the different, I mean, it was muscle relaxers, opiates, just mixing and matching.
My first coach.
All of these drugs. Yes.
Yeah,
it was insane. And so you see this, and opiates in general, I mean, they're harder to get now. I mean, there was a time, probably 10 years ago. I mean, you go into a doctor, you tell them you train MMA, you're a fighter, and they'll just hand you bottles of everything that you could ever ask for. Like, what do you need? And you go back every other week and get whatever you want. We're not able to get, things like that. Just people in general can't get drugs the way that they used to. And didn't you say that you've treated patients to get off of opiates?
Yeah. So, when we see a pain patient now, a lot of times the referral comes with medication reduction as a piece of it.
Okay.
And so, the patient is now maxed out their morphine equivalency rate.
Okay.
They're on too many meds. The doctor is worried about their own license at this point, and they want to start pulling back some of those things. Knowing that ketamine can help with the pain.
Okay.
And it also helps with what's the word I'm looking for? Withdrawal symptoms.
Does it?
Yeah,
okay.
Absolutely. So I don't think that's highly studied as it should be.
Okay.
There's a lot of drawbacks with that piece of things, but it does help with withdrawal symptoms. I can tell you we've successfully seen it. We've successfully done it. And even for alcohol, smoking, multiple different things.
I looked, I mentioned this a little bit earlier. I was looking at USADA, where ketamine could fit in MMA, but sports in general. Just in general, you talked about the NBA. But in MMA, I feel like there's a lot of fighters that have anxiety, depression. They're like broken. These if you're not broken, you're going into like the NBA or like other sports.
Even existing injuries when you come like that, that's debilitating to somebody who is training for a fight and had a lot riding on this fight, and now they're injured and they have to wait a long time to fight again.
Do you think ketamine would help with so as a coach, I always look at mental state. Mm-hmm. That's all it is. It doesn't matter if you're a good fighter, fine, yay. As long as you're conditioned, you show up and fight. That's all that matters.
Absolutely.
And what blocks that most of the time is adrenaline. People don't perform. They don't perform as well. Do you think that ketamine dosing would help with anxiety and adrenaline? I don't know. And this isn't something you've been tested or you're a medical professional. This isn't a thing. This is just we're just talking. I'm curious. Do you think that would help or would it?
Yeah, I think people. We've been around fighters for so long. They work themselves up into such a frenzy.
Yes.
And their mind's just not clear. It's what happens if I lose, or what happens if I do this, or what happens if, and there's just no clarity in the mind. Yeah. And so I can only take what I hear from my patients and when they're talking about clarity and assume that it might help. Like that being able to kind of go in a little bit more calm and then fire up when it's time to fire up.
Yeah, I'm curious. Like I said, USADA doesn't, I searched their website, I looked on stuff, and I actually sent an email out to some representatives at USADA. So I'm trying to get. Hopefully, I have an answer before this airs. I can add an update. But I didn't see any mention of ketamine anywhere on USADA, which I thought was interesting.
Interesting.
Not even as a recreational drug. Like I didn't see it anywhere. And I know they do have certain things that out of competition testing. I'm not sure what the in competition window is. Do you know, Gabe, what the I don't know what the window is of that. Is it a week or 2 weeks or 4 weeks or what? Mm-hmm. But if you were able to do that, I know even people have been busted with cocaine,
right?
But it's out of competition, so it doesn't matter. It's not like you can't do that if it's a week before a fight. Yeah, you're going to get in trouble. You're going to get suspended. But out of competition stuff, and of course, marijuana is fine now for the most part. You can drink. You can't drink the day of a fight.
Right.
You'd get suspended. But out of competition stuff, and so I wonder.
Use inhalers now.
Whether you can or you can't, you will. We can just start grabbing, and that's what I'm going to do. All right, mid-fight, next person I'm cornering, in between rounds, ketamine infusion. Yeah. Go out there round 2, if they don't fall asleep and fall face down, they're winning the fight.
They're going to end up fighting the ref. Because the ref looks like a bear. And like, so.
Yeah, I wonder about that. And we were talking about a little bit earlier, beta blockers. Like people don't know, or might not know, the beta blockers on USADA's list, at least it was golf, billiards. And why is billiards being like regulated by USADA? Let them take whatever they want. All the steroids, cocaine, crack, yes, like it's billiards. Like let them take whatever they want to take. Please, can we do this? Can we start a petition? But there's some other things on there too. It's like, I forget, but sports where I'm like, why are people, what? Let them take whatever the hell they want.
I mean, high-performing athletes taking high-performance drugs for...
Go for it.
What they do.
Go. But I think like beta blockers are weird because like CEOs will take beta blockers if they have a big speech.
Yep.
Presidents will take beta blockers. And, nerves. It helps with the nerves. Helps with the adrenaline. I get that on high adrenaline sports. But I wonder, I guess my point of this was looking at beta blockers. One, if they're not... In MMA had no mention of beta blockers as being illegal. Like, I don't understand. And I'm not familiar enough with them. Maybe they would make you slower, slow your heart rate or something.
Yeah, I mean, it definitely slows your heart rate some.
But a little bit, you almost want to, like, hey, if that'll pull that adrenaline back, I would say go for it. Again, if it was legal, you have to go through the proper channels. But in my head, I was thinking beta blockers, that ketamine would kind of do something similar to a beta blocker over the course of weeks out with it.
Yeah.
Put you in a more calm state, a more relaxed state, a more state of clarity as opposed to the frenzy that we're always in, getting ready to go.
I think it's based
rock
on
it out.
If that patient or if that fighter has diagnosis. I think it definitely has to be diagnosed that patient has a problem.
Okay, so you don't just think it's going to help every fighter out there, but if that fighter is suffering because he has anxiety or depression or things like that are causing him to overthink or her and to have this baggage, for lack of a better term, that it might help reduce that.
And we know plenty of fighters that have had that piece, or we assumed.
So we know fighters.
Yeah, basically.
Like fighters, they got the baggage.
I think where ketamine would help a lot of fighters is rehabilitation, actually.
Really? Like after injury or after a fight in general?
After injury. So ketamine, again, blocking certain receptors for pain, is non-narcotic. And so when you are rehabbing, you're going through this ungodly pain. You're taking medications that are clearly slowing you down, narcotics backing you up, so on and so forth. A lot of drawbacks to taking narcotics. And with ketamine, they technically do something very similar in blocking pain receptors and allowing you to kind of continue to move. My only worry with that is people overdoing it because they feel good.
Okay.
Yeah.
Yeah, you feel good. Oh, I can do this. I can go run a marathon.
Plus, it works on that psych piece of things, too.
What are some of the side effects of ketamine? There's got to be some, like...
The most common one, the dissociation that we talked about, the hallucinations. Okay. And
now, when you say dissociation and hallucinations, are you talking about during treatment itself, or is this post-treatment afterwards?
During treatment. Once, I would say, within 30 minutes after the treatment's over, that stuff's not going to reoccur.
Do you ever have people panic during the...
Yeah.
Oh, really?
Yeah.
What do you do if somebody panics? Somebody's...
Benzos.
Oh, okay. Just pump them up full of benzos.
We always try to kind of take care of the patient the best we possibly can. Starting with our moms kind of set the base of how we should treat all patients. So we treat everybody kind of like family.
Okay.
And we try to talk them and go to what they're doing. If a patient is having a bad experience and they're tripping, we will make adjustments to the infusion.
Okay.
So they can continue to get it. We might add some benzos, talk to them. We'll sit with them if we need to kind of get them to where they need to be. And but for the most part, it's pretty low dose. We don't really come across it very often.
Okay. What other side effects do you guys experience?
Increased blood pressure is another one. So that's pretty common.
Now, again, is that a long-term thing, or is that just during the treatment itself?
Just during the treatment itself.
Okay.
Yeah, so just during the treatment itself. Any kind of side effects post-treatment are pretty rare, actually.
Okay.
Very rare.
Just treatment specific.
Mm-hmm. You might see some anxiety the next day, depending on what you're dealing with. Fatigue. If they're taking long treatments, the treatments can last an hour. Some for chronic pain, certain pain conditions be 4 hours.
Oh, okay.
And patients tend to clinch up during those 4-hour ones. And so after several days of treatment, they're super sore.
They're sore, okay.
They're sore. It's like they've been
Well, I guess that
working out.
alone, I mean, I don't know if you'd call it a side effect, but it's a drawback or it's something to think about. It's time consuming. This is not like you get to, and see, that's what people want this. They want to take a pill.
Yeah.
They want to take a pill, call it a night, everything's good. But you've got to actually sit there. How long? So you go, my treatment's at 8 a.m. in the morning. I go in, I show up, I do my treatment for an hour. It's 9. How long am I pretty much incapacitated for that day? Like, of course, I'll have to get a ride home.
Yeah, can't drive that day.
Okay. Oh, even for the rest of the day.
Yeah, you're done.
Okay.
No driving.
There's a wrap.
I wouldn't say you're going back to work that day.
Okay.
It is something that you kind of have to commit to. And we try to explain that to everybody. It's something you got to commit to. It's not a pill. You're going to go on your business, and hopefully these drawbacks
But this
don't
isn't
happen.
for people that just are having a little bit of anxiety and depression. This is people that are being debilitated by anxiety and depression
Exactly.
and PTSD.
Exactly.
This is major stuff. And so you're thinking, all right, are you willing to commit 2 weeks of your life, for the start, and then of course, treatments here and there, to feeling normal again?
Yeah, these are all major cases.
Okay.
And it even goes a little deeper than that. So suicidality, for instance.
Okay.
So suicidality can be turned over in one treatment.
Really?
For ketamine. So it's becoming, you're starting to see ketamine infusion being built into ERs now. So that's kind of a newer thing that we're kind of seeing. Ketamine as a drug is FDA approved. Ketamine infusion is non-FDA approved. It's used off-label. That makes collecting from insurance very difficult. And so most ketamine places are cash pay.
And how much does treatment cost? Not just at your clinic, but just in general.
I would say the average, anytime you go get a cash treatment, it's $550 per treatment. That's for like the 1 hour,
So it's pricey. That's a pricey thing.
That's $3,300.
That's not cheap. Yeah, that's a lot of money. Mm-hmm. But, I guess, if you're seeing results and you're no longer debilitated to the point where you were.
I always tell people you got to kind of invest in your health.
Yeah.
Like, I look at $3,300.
I never say that, ever. I invest in Twinkies and Starbucks. But.
Squirt.
Squirts.
But again, you kind of got to invest in your health.
But a car,
that's a car. That's a down payment on a car.
That's a down payment on a car. That's a big deal. But it's also
can't drive the car if you're stuck in bed. And in the end, when it all comes down to it, what we're looking for with patients and results and PHQ scores and all these things, and we track all these cool things on our EMR, and we have a very unique system at my clinic in particular. We're doing things a little bit different than most of the clinics in the country, to my understanding. But in the end, it's all about quality of life.
Okay.
If we can increase quality of life, we have won.
Is there a lot of research on ketamine right now? Are people doing research? Are they?
Yeah. So
what's going on?
Research is happening. It's all over.
Is there scholarly studies? Is there stuff published?
Yale's done some really good ones. Really, a Google search for ketamine infusion is really all it takes. You're not going to find a lot of drawbacks, oddly enough, on the internet. I know there's a lot of haters on the internet.
Okay.
Stay away from WebMD. They have their opinions on certain things, but really, if you kind of Google ketamine infusion at this point, it is turning the corner as a very important treatment to what's coming next. If somebody is suffering from depression or PTSD or any kind of behavioral health thing, or know somebody who is, I would say consider it. It is a very unique treatment, and it affects people much differently. It's the unique thing, and my favorite thing about what I do on a daily basis is that I get to deal with patients, and I also get to deal with their family. And so it's not just me getting to read a paper chart or read like the EMR and say, oh, you're getting better based on these numbers. It's hearing their story, telling me they're getting better, and then hearing their husband, their wife, or their children saying, oh my goodness, we went to the movies, we did this, we did all this, and really getting to feel the stories behind these patients. And so I would say, if you know somebody, recommend them to ketamine, do some research on it.
Now, before we go, BMF belt, who's winning it this weekend? Ooh. Nate Diaz, Jorge Masvidal.
Man, I'm a fan of both fighters.
Don't toe the line. Don't toe the line. Don't do that to me. You're better than that, Sonny.
I am better than that. Nate Diaz is going to win this fight.
You're wrong.
No, I'm not.
You're all wrong.
This is why. Masvidal has better stand-up. It's clear. And he will catch Nate, and Nate will drag him to the ground.
No! See, Nate can't wrestle, and Diaz can wrestle. Or what?
Right.
That didn't make any damn sense. Yeah. And Masvidal can wrestle.
Strike that one.
Yeah, all right.
Masvidal
clearly, I don't know what I'm talking about.
He can wrestle. No, he's a great fighter.
I don't know that
one
Masvidal is going to... Man, I think Masvidal is he has the best jab in MMA.
Yes.
Fight me. Fight me. No, he has the best freaking jab in MMA.
Second.
Who's number
Co-signed.
one? Oh, second. I thought you were saying he has a second.
Co-signed.
I think Masvidal wins it. People are counting him out. People are thinking.
I'm not counting him out. It can be a close. It's going to be.
No,
a
you just
great
did. You
fight.
said Nate's going to win. So you
Clearly,
counted
we
him
have
out.
the same last name.
Yeah.
So I mean,
you can't. He's like my third cousin.
Yeah. So I'm just a big fan of the Diaz brothers.
Yeah.
And so when it comes down to it, if I have to pick one, I'm picking Nate. I like Nate. I like his swag. I like everything about his game except for his stand-up. It's sloppy to me. It's wide, and I think he's going to get picked apart. But I think he's still going to find a way to win.
Yeah.
And I know people might argue with that, and they like his stand-up and stuff. I just like that, Masvidal has a tighter game, and I think that stand-up wise, he's going to dominate.
Yeah. I think you're right there. I think Masvidal ends up winning it. Other than that, thanks for coming on.
Thank you for having me.
And remember, people, subscribe, like, share. Go do your research on some ketamine. Watch Nate Diaz lose. And I love Nate Diaz, but Masvidal's going to win this weekend. We'll see you next time.